Hi, I'm Donna Loeb from Diamond Systems USA, and we're here today to give you an explanation and provide you with a training educational video on microdermabrasion. We here at Diamond Systems can provide for different levels of exfoliation. Our systems have the traditional aluminum oxide crystals, which is the white powder that you see right here. And then at Diamond Systems, we also provide for an alternative medium, which would be an organic grains. The organic grains is the brown material in the back canister. The aluminum oxide crystals are your best exfoliator to the skin. Due to the nature of aluminum oxide, it's very hard, it's very sharp, and the faceted edges of the crystals are a wonderful exfoliator to the skin. They do bring up the stratum corneum layer very, very effectively with the most minimal of abrasion. The organic grains are also used as an exfoliator, yet being that they are totally an organic medium made of cellulose, litigens, wood pulp, and walnut shells. This makes it a very, very soft material that will provide your clients with an additional exfoliation whereby we will not only break the stratum corneum layer with the aluminum oxide, but you will use the organic grains in addition to the aluminum oxide to buff and polish the skin. The skin will result in being porcelain, very smooth, and very shiny. The Diamond system can provide you with different layers of machines. Our traditional machine will use the aluminum oxide crystals solely. We also have a machine that will provide you for the use of both the aluminum oxide and the organics. And then we go further to provide you with a system, just as we see here, the Oxyderm, that will provide you for a combination whereby you can make your selection based on your client's needs. We can just do aluminum oxide, we can just do organics for those earth-friendly people, and then we can also use the combination of two for skins that are more sensitive and more thin. I would like to discuss microdermabrasion very briefly with you. The process of microdermabrasion is the exfoliation of the stratum corneum layer. Not only do we break the top layer of skin to bring off all the dead cells, but we also do a cellular stimulation whereby we are bringing up blood flow up to the surface, to the skin level, to form a rebound effect. This rebound effect will give you wonderful results in cellular turnover, collagen stimulation, as well as renewed elasticity. With microdermabrasion, utilizing the Diamond system, you do have the ability to select the medium that will meet your client's needs. The purpose of this video is to provide you with the basic techniques of microdermabrasion. We will take you through the different levels of settings with microdermabrasion units. We do have two controls. One control is for suction, the other control is for the crystal and/or organic flow. It is important at the beginning of the treatment to take a look at the client's skin. Look at the pinking level to determine if your setting is appropriate. We will then follow up with post-microdermabrasion care. It is so important to cool the skin, to hydrate the skin, and to close the skin, and to take it one layer further to put that sunscreen on. What we need to do is to educate the client to understand the needs of proper skin care. Let's get started with our pre-microdermabrasion setup. Prepare your treatment area before the client arrives, having sterile gloves, headband, bowl of warm water, sponges, and of course your diamond crystal medium, which will be used for your main exfoliation, the white crystals, also called corundum crystals, and if your diamond system does provide for a diamond organic peel, the brown organic grains, a new plastic tip. Tips can be washed or saved for the client series, thus making a more economical per treatment cost. The grains, once again, are unique to Diamond Systems and provide for the exclusive buffing and polishing of the skin. Now you are ready to have your client enter the treatment area and enjoy the benefits of microdermabrasion. Skin beauty starts with a clean, fresh skin. We must remove any makeup and surface oil using a balanced cleanser. We recommend the Diamond Dermacare Biomarine Cleanser, Cellular Deep Cleanse, or Antibacterial Cleanser. Dermacare cleansers work to keep the skin surface bacteria-free without drying the skin, leaving a film, or blocking pores. Clean the skin using a sponge or gauze type of 4x4 pad. Refrain from using cotton pads that will leave fibers behind, which may be vacuumed into the system. Dry the skin with a towel or soft cloth. If treating a thick or congested skin type, you may use a toner, such as Dermacare Skin Prep. Apply the toner to the skin, leave on the surface for 2 to 3 minutes, and remove with warm water. Toners must be removed before treatment because it will leave the skin tacky, making it difficult to glide the handpiece. The skin must be bone dry. At this point, the skin has been dried and we are ready to set the system levels. Place your new tip on the handpiece and turn on your system. Turn the suction dial to full and turn the media dial to off. To be sure the vacuum pressure is at maximum, place your finger on top of the handpiece and the suction indicator on the left side will go between 70 and 80 if all areas are secure. At this time, turn the crystal flow at the side of the machine to on if you have a unit that provides for the toggle switch. At this time, turn your crystal flow to 2 or 3, which will equate to about 4 o'clock on the face of a clock. Now you're ready to set your suction indicator. Reduce the suction level and bring it to about 3 o'clock on the face of the clock. Release the handpiece, place your finger back on the handpiece, and you will be working at 40 kPa. As you take your finger off the handpiece, you will go down to idle. 40 kPa is appropriate for all skin types. Place a new tip on the handpiece. You will know if 40 is an appropriate level by seeing if the skin pinks up after the first few passes. If the skin becomes very red, turn the suction dial down 3 points. Always hold the top of the handpiece closed to get an accurate reading of the suction level. You will also see a bubbling of the crystals or organic media depending on which canister is opened. Hold the forehead in the middle with one finger and move horizontally toward the temple. By holding the skin with one finger, you will anchor the skin, reducing any surface lift. Place the hand